6 commonly used medications might be increasing your chances of having a heart attack without you even realizing it. In this important video, we will explore these drugs and how they may affect your heart health. Recognizing these hidden risks is essential for making informed choices about your well-being. If you are serious about protecting your health, make sure to subscribe to Health Hub and click the notification bell so you can stay informed with our latest tips and insights. 2. Keep your heart strong and healthy. 1. Hormonal contraceptives. Hormonal contraceptives have been a significant tool for women in family planning and maintaining reproductive control. However, their use has been linked to different levels of cardiovascular risk. Understanding these potential dangers is key when selecting a birth control method. Combined hormonal contraceptives (CHCS), which contain both estrogen and progestin, are available in pills, patches, and vaginal rings. Studies have shown that CHCS can increase the likelihood of arterial thrombotic events, such as heart attacks and ischemic strokes. A large study involving more than 2 million Danish women between 15 and 49 years old found that users of estrogen-progestin combination pills had about double the risk of these events. This equals roughly 1 extra stroke for every 4,760 women and 1 extra heart attack for every 10,000 women each year. Interestingly, non-oral forms of CHCS showed even greater risks. For example, vaginal rings were connected to a 3.8 times higher chance of heart attack. This is thought to be due to estrogen's effect on the blood's clotting process, making clots more likely. This is especially concerning for women who smoke, have high blood pressure, or high cholesterol. Progestin-only contraceptives, available as pills, injections, implants, or intrauterine devices (IUDs), generally present a lower cardiovascular risk compared to CHCS. The same Danish study showed that progestin-only methods carried a slightly higher risk, but still much less than estrogen-containing options. Importantly, the progestin-only IUD did not show any increased risk of heart attack or stroke, making it a safer choice for women concerned about cardiovascular issues. 2. Non-steroidal anti-inflammatory drugs (NSAIDs). NSAIDs are widely used to relieve pain, reduce inflammation, and lower fever. Common over-the-counter NSAIDs include ibuprofen and naproxen. While effective, these drugs have been linked to a higher risk of cardiovascular problems, including heart attacks and strokes. NSAIDs work by blocking cyclooxygenase COX enzymes, specifically COX-1 and COX-2, which are involved in producing prostaglandins compounds that help control inflammation and other body functions. Blocking these enzymes can upset the balance between blood vessel constriction and dilation, as well as affect platelet function, which may increase the risk of blood clots. This imbalance is especially concerning for people with existing heart problems. The U.S. Food and Drug Administration (FDA) warns that the risk of heart attack or stroke can occur as early as the first weeks of NSAID use, and this risk can rise with higher doses or longer use. This warning applies to both over-the-counter and prescription NSAIDs. Not all NSAIDs carry the same level of risk. For example, diclofenac is linked to a higher risk of major heart events, while naproxen appears to have a safer cardiovascular profile. Because of these potential dangers, NSAIDs should be used carefully. Before starting NSAID therapy, a patient's heart history and risk factors should be reviewed. The lowest effective dose should be used for the shortest possible time. Blood pressure should be monitored, and any signs of heart-related side effects should be watched for, especially in long-term users. For people at high cardiovascular risk, alternative pain treatments with less risk should be considered. 3. Thiazolidine diabetes medications. These drugs, such as rosiglitazone, were developed to help people with type 2 diabetes improve blood sugar control by increasing insulin sensitivity. However, concerns about their heart safety have affected how often they are prescribed and their regulatory approval. Rosiglitazone works by activating a receptor called PPAR-gamma, which changes the activity of genes involved in sugar and fat metabolism. While this helps lower blood sugar, it can also affect fluid balance and fat levels in the blood, which may harm the heart. Research on rosiglitazone's heart safety has been extensive and sometimes controversial. A major study published in the New England Journal of Medicine in 2007 suggested a 43% higher risk of heart attack among users. Many studies have shown a link between rosiglitazone and heart failure. While some reviews found no clear increase in heart attack risk, the chance of heart failure was consistently higher. Observational research on stroke or death from all causes has produced mixed results, with some studies showing risk and others not. This ongoing debate highlights the need for strict monitoring and thorough evaluation of drug safety. Doctors must balance the benefits of blood sugar control with the potential heart risks when prescribing these medications. In many cases, safer alternatives are preferred, especially for patients who already have heart disease or other risk factors. For certain antidepressants, tricyclic antidepressants TCAs and selective serotonin reuptake inhibitors SRIs are widely prescribed to treat depression. While both can be effective, they may cause cardiovascular side effects that need to be considered when choosing a treatment. TCAs such as amitriptyline and nortriptyline work by blocking the reuptake of neurotransmitters like norepinephrine and serotonin, which helps improve mood. However, their pharmacological actions can influence several heart functions. TCAs may cause a significant drop in blood pressure when standing up, leading to dizziness and a higher chance of falls. This happens mainly because they block alpha-adrenergic receptors. They can also slow the electrical conduction in the heart, seen as increased PR, QRS, and QT intervals on an electrocardiogram ECG. These changes can raise the risk of arrhythmias, including ventricular tachycardia and fibrillation. In addition, TCAs often cause a faster heart rate due to their anticholinergic effects, which can be a problem for people with pre-existing heart issues. Because of these risks, TCAs should be used cautiously in patients with cardiovascular disease, and alternative options may be a better choice in these cases. SRIs, such as fluoxetine and sertraline, selectively block serotonin reuptake to improve mood and are generally considered safer for the heart than TCAs. However, some SRIs, particularly citalopram and escitalopram, have been linked to dose-dependent QT interval prolongation, which can lead to a rare but serious arrhythmia known as torsades de pointes. For this reason, the FDA advises limiting the maximum daily dose of citalopram. SRIs can also occasionally cause low blood pressure when standing and a slower heart rate, although these effects are usually mild. They are often preferred over TCAs for patients with depression who also have heart disease, but individual risk factors and possible drug interactions should always be taken into account. 5. Pseudoephedrine. Pseudoephedrine is a common decongestant found in many over-the-counter cold and allergy medications. It is effective at clearing nasal congestion by stimulating alpha-adrenergic receptors, which causes blood vessels in the nasal passages to constrict. This reduces swelling and makes breathing easier. However, this effect is not limited to the nose. Pseudoephedrine can cause blood vessel constriction throughout the body, potentially affecting heart function. This medication can raise blood pressure and heart rate due to its systemic vasoconstriction. Studies show that in patients with controlled high blood pressure, pseudoephedrine may cause a small increase in systolic pressure. There have also been reports linking its use to acute coronary syndromes, such as heart attacks. Its stimulating effects can raise the heart's oxygen demand, possibly triggering cardiac events in vulnerable individuals. Pseudoephedrine may also cause arrhythmias, including rapid heartbeat, which is especially concerning for people with underlying heart problems or those taking other drugs that affect heart rhythm. People with heart conditions such as high blood pressure or arrhythmias should talk to their doctor before using medications containing pseudoephedrine. Safer alternatives may be recommended. Even for healthy individuals, it is wise to monitor blood pressure and heart rate when taking this medication, especially at higher doses or for longer periods. Pseudoephedrine can also interact with other drugs, such as monoamine oxidase inhibitors, myosin beta blockers, increasing its cardiovascular impact. Always inform healthcare providers about all medications being taken to avoid harmful interactions. If you found this video helpful, please click the like button. It really helps us bring more valuable content. Leave a comment below with your thoughts, questions, or suggestions for future topics. And of course, hit the subscribe button and turn on notifications so you never miss our latest health tips and insights. Stay informed, stay healthy, and we'll see you in the next video.